Hello everyone, welcome. Today I'm going to discuss about oxygen hemoglobin dissociation curve, and as you might already know that oxygen hemoglobin dissociation curve is one of the very important topic in your respiratory physiology. And this curve is actually a plot which shows us the relationship between the partial pressure of oxygen and the percent saturation of hemoglobin, and different level of partial pressure of oxygen actually changes the saturation. Suppose someone has a partial pressure of oxygen of 100 millimeter mercury in his or her arterial blood, and here in this partial pressure of oxygen the hemoglobin is about 100% saturated. It means that all four hemoglobin moieties in a single hemoglobin molecule are bound to oxygen. At partial pressure of 40 millimeters mercury, which can be found in the blood coming from the tissue to the lungs, here the hemoglobin is about 75% saturated. So 3 out of 4 hemoglobin moieties have oxygen. At partial pressure of oxygen of 25 millimeters of mercury, hemoglobin is about 50% saturated, and that is called the P50. And 50% saturation means that 2 out of 4 hemoglobin molecules have oxygen bound to them. So here is, you can see the oxygen hemoglobin dissociation curve. We go to this discussion and come back here. So as you can see that oxygen hemoglobin dissociation curve is sigmoid shape. So it looks like a sigma. So this is the oxygen hemoglobin dissociation curve. This is sigmoid shape. And why it is sigmoid shape? This is a result of positive cooperativity, and it occurs due to increase in affinity for successive oxygens binding to hemoglobin. So binding of the first oxygen molecule increase affinity for second, and so forth. So affinity for the fourth oxygen molecule is highest, and this change in affinity facilitates the oxygen loading in the lungs, which is represented by the flat portion of the curve, which is this portion of the curve. So this portion of the curve is for lungs. And one contrast should be made with myoglobin, and the myoglobin is actually monomeric, and that's why it does not show positive cooperativity. So the curve that lacks sigmoidal appearance. And here we can see the oxygen hemoglobin dissociation curve again. So this portion, if we start from the partial pressure of oxygen of about 100 millimeters of mercury, so we start from here, which is about 100% saturation of hemoglobin, and then as the blood leaves lungs, the saturation starts to fall because the partial pressure of oxygen starts to fall. This occurs due to uptake of oxygen starting in the tissues. So the level steadily falls up to a level of about 40 millimeters of mercury, which is the mixed venous plasma oxygen partial pressure of oxygen. And as you can see, this portion is the flat portion, which is for the lungs, and this portion is the steep portion, which is for the tissues. This flat portion facilitates the loading of oxygen into hemoglobin due to increased affinity, and this steep portion facilitates the unloading of oxygen from hemoglobin due to decreased affinity of hemoglobin for oxygen, which also occurs due to the effect of cooperativity. So in the lungs, the alveolar gas has a partial pressure of about 100 millimeters mercury, and so the pulmonary capillary blood also have a partial pressure of about 100 millimeters mercury, and the very high affinity facilitates the oxygen unloading. And one important fact to remember that the curve is almost flat when the partial pressure is from about 60 to 70 to 100. It's almost flat, and that's why humans can tolerate changes in atmospheric pressure at this level without a change in hemoglobin saturation or oxygen carrying capacity of hemoglobin. So in the peripheral portion, which is represented by the steep portion of the curve, here there is lower affinity of hemoglobin for oxygen, and this facilitates the unloading of oxygen to the tissues. So let's talk about what changes the curve or what shifts the curve. So the shift of the curve to right or left actually depends on the affinity of hemoglobin for oxygen. So if there is an increased affinity of hemoglobin for oxygen, there will be shift to left, and if there is a decreased affinity for hemoglobin for oxygen, there will be shift to right. So shift to right occurs when there is decreased affinity. And here, as there is decreased affinity, the level of P50 needed to achieve a 50% saturation is increased. So P50 is increased, and this helps actually the unloading of oxygen from arterial blood to the tissue, because as the oxygen does not have that much of an affinity for oxygen, the oxygen easily leaves hemoglobin and gets into the tissues. And that's why for any level of partial pressure of oxygen, the percent saturation of hemoglobin is decreased when there is a shift to the right. And in case of shift to right, as there is a decrease in affinity of hemoglobin for oxygen, there is actually formation of taut form, which occurs due to deoxygenation. And as you can remember that right shift for tissue, right for tissue. So what are the causes of right shift? So there are multiple causes. Most of the causes actually represent the situations that can be created by increased tissue metabolism. So if there is an increased tissue metabolism, like during exercise, there can be increased production of carbon dioxide, leading to a decrease in pH. So those are the situations where there is a decrease in affinity of hemoglobin for oxygen, which causes increased unloading of oxygen in the tissues, which actually helps the exercise process. And also, increase in temperature reduces the oxygen affinity and facilitates oxygen unloading. Increasing in 2,3-diphosphoglycerate also facilitates the unloading of hemoglobin due to decreased affinity of hemoglobin for oxygen. And this is actually one of the mechanisms for adaptation to chronic hypoxemia. So in case of chronic hypoxemia, like which is seen in high altitude, living in high altitude, it causes an increase in DPG, which decreases the affinity of hemoglobin for oxygen, leading to release of more oxygen or unloading of more oxygen in the tissues. So we can remember the causes of shift to right by this. Ace bats right-handed. So Ace is a person who bats right-handed. So A is remembering acid, which is hydrogen. So if there is an increase in hydrogen, it causes a right shift. C is carbon dioxide. E for exercise. B for 2,3-BPG. A for altitude, and T for temperature. And those all are the situations which can be created for the benefit of the tissue. So right shift for tissue, right for tissue. And let's talk about what are the causes of shift to left. So those are actually the situations where the affinity of hemoglobin is actually increased, and as the affinity of hemoglobin increase, oxygen easily binds to hemoglobin, and so P50 is decreased. And the causes of shift to left are actually the mirror image of the causes of shift to right. So those include decrease in partial pressure of carbon dioxide, increased pH, decreased temperature, decreased 2,3-diphosphoglycerate concentration. So the basics of right and left shift is an increase in all factors including hydrogen ion causes a shift of the curve to the right. So increase means positive change, it means right change. A decrease in all factors including hydrogen ion causes a shift to the curve to the left. So decrease is a negative thing. So negative or leftward change. And one important point to remember is fetal hemoglobin has higher affinity for oxygen than adult hemoglobin. So the dissociation curve is shifted to left. And the fact should be remembered, very important for you. So here you can see the causes of this is the green portion is the real curve for normal healthy person, and here you can see the shift to right, and here you can see the shift to left. So all the situations where the factors increase, this should be the hydrogen ion, so no confusion. Hydrogen ion increase meaning decrease in pH. So all increase in all factors causes a shift to right, and decrease in all factors, this is the hydrogen ion, shift to left. So let's talk about a carboxyhemoglobin. So this is a special form of hemoglobin which is formed when someone is trapped inside a room where there is fire burning. So this is hemoglobin bound to carbon monoxide in place of oxygen. And carbon monoxide has a higher affinity for hemoglobin than oxygen. Suppose about 200 times more affinity. and that's why carbon dioxide competes with oxygen and displaces oxygen from hemoglobin. And so hemoglobin cannot bind to oxygen, and oxygen binding capacity of hemoglobin decreases, so there is decrease in oxygen content of blood, and there is shift of the oxygen hemoglobin dissociation curve to the left because binding of carbon monoxide to the hemoglobin increases the affinity of remaining sites for oxygen, and as the oxygen affinity for hemoglobin is increased in certain limit, it causes a decrease in oxygen unloading in tissue. This is a paradoxical change, and we should treat the patient with 100% oxygen and hyperbaric oxygen. So here you can see the oxygen hemoglobin dissociation curve change with carbon monoxide. So the curve is here, the greenish curve. So first it is shift to left a bit, and as you can see the hemoglobin saturation does not reach that much, so 50% carboxyhemoglobin saturation. So that's all from me today. Thanks all for watching my video.